Good afternoon, everybody. This is Tanya Dorf-Bruner, and I'm at Oral Health Kansas. I want to welcome you to our webinar this afternoon. We are excited to have the chance to talk about the dental coverage in the marketplace in Kansas. We're in a little bit of an uncertain time, but we know that one of the most important things that's happened in the dental landscape in many, many years was when the Affordable Care Act was passed and included dental benefit for all children. The problem is the dental benefit's a little bit complicated in how it's accessed by families, and there's just some nuance that we think that is important to be able to share with navigators and with families. And so that's why we're here today, is to learn a little bit more about those details and about the specific plans offered in Kansas and how they work. So today with us we have one of the nation's leading experts on the Affordable Care Act and the pediatric dental benefit, and that's Colin Rusch. He's a senior policy analyst at the Children's Dental Health Project, and he's been working on and analyzing the Affordable Care Act since it passed in 2010. So I'm really happy today to welcome Colin Rusch. I will say we'll let Colin get through his presentation, and then we'll have ample time for questions. If you have any questions throughout the webinar, please feel free to type a question into the question box, and we'll answer that as soon as we can. You also have the opportunity to just raise your hand. There's a little place to raise your hand on the navigation bar there. And so when you raise it, we'll call on you and unmute you so that we can make sure you can ask your question. So without further ado, I'm going to introduce Colin Rusch from the Children's Dental Health Project.
Thank you, Tanya. And so, as Tanya mentioned, I'm going to spend a little bit of time kind of talking about the background of what makes the pediatric dental benefit under the Affordable Care Act a little bit complicated for families, and then spend the bulk of our time talking about how dental coverage is offered through the Kansas marketplace and what the most important factors are for consumers to consider when they're shopping on the marketplace. So, into that background, as most of you probably already know, the ACA did establish an essential health benefits package that included pediatric dental coverage. It's really intended to be one piece of a comprehensive pediatric benefit package. So this is Category 10 of the Essential Health Benefits, or EHB as many call it, which is pediatric services including oral and vision care. So this is coverage that would be offered on the marketplace as well as in the existing small group and individual insurance markets in each state to children and adolescents up to age 19. However, as Tanya mentioned, the ACA does treat dental benefits a little differently. It also makes some changes to dental benefits as we know them for kids, or as we previously knew them for kids. So in addition to making dental coverage part of the essential health benefits, meaning that it has to be offered on the marketplace, there are subsidies for coverage on the marketplace which attempt to subsidize dental coverage but don't always quite get there, and we'll talk about that later. There are also limits on cost sharing, also known as out-of-pocket maximums, and this is a relatively new concept for dental insurance, as well as the removal of annual and lifetime dollar limits on coverage. Again, a new concept for dental insurance. Traditionally, dental insurance has been a limited benefit. So, for example, you would have your benefits laid out, but have a $1,000 or $1,200 limit on that coverage. So once you incur $1,200 worth of covered services, you're basically on the hook for everything afterwards. So this change actually makes pediatric dental coverage under the ACA work much more like a true insurance product. It does, however, limit orthodontic coverage to coverage as medically necessary. So we're not just talking cosmetic braces and things of that nature, but really services that are aimed at dealing with medically necessary situations. It also integrates oral health into medical coverage in a couple of ways, one of which is through preventive services that must be covered at no cost to beneficiaries. So the ACA laid out a whole host of preventive services that must be covered by all health plans at no cost. So even if there's a deductible, it's first dollar coverage. Those services are automatically covered. And under that list of preventive services are a few oral health or dental related services. So one is an oral health risk assessment by a pediatrician for young children and a referral to a dentist. Fluoride supplements that would be prescribed for children who don't have access to community water fluoridation. And most recently, fluoride varnish application by pediatricians for all children through age 5. So again, these are services that regardless of whether or not a child has distinct dental coverage, if they have a health plan on the marketplace, their health plan must be covering these preventive oral health services. So looking a little more closely at how this is implemented in the Kansas marketplace itself, and just to be clear, Kansas is a state that did not choose to establish their own marketplace or exchange, but rather has relied on the federal government to provide that platform and do the administration of the marketplace and the plans available. So, one of the first questions is what dental services are actually required to be covered in plans that offer on the marketplace. This is really a result of the benchmark plan that was chosen from the get-go, and that benchmark plan for dental is the state's Children's Health Insurance Program, or CHIP, also known as HealthWave in Kansas. So that is really the basis for the services that must be covered. And here you'll see kind of the three major categories: preventive and diagnostic services like your dental exams and x-rays, cleanings, fluoride treatments, dental sealants for molars, and some other basic services. Then you move on to treatment services, which are a little more invasive and a little more involved, so things like fillings, crowns, root canals, treatment for gum disease, and things of that nature. And then finally, orthodontic services or oral surgery and other medically necessary services. So in addition to orthodontics that would be used to address problems like misalignment that results in a child not being able to chew or speak properly, you'd also have services aimed at addressing more serious medical issues like abscesses, cleft palate, oral cancer, and things of that nature. I should be clear in saying that this benchmark only outlines the services that have to be covered. It does not outline how those services have to be covered or what the cost sharing should look like. So in terms of how dental coverage is allowed to be offered from a plan perspective, the law allows pediatric dental benefits to be offered through either a standalone dental plan, which is distinct and separate from a health plan, or through a qualified health plan that actually embeds or includes the dental benefits in that product. On the back end, this may take the form of a health plan contracting with an existing dental insurer, but from the consumer's perspective, it's one integrated product with one premium. The law also allows health plans to choose not to include pediatric dental coverage in their products if at least one standalone dental plan is offering in the marketplace, which is, for the most part, almost always the case, and is certainly the case in Kansas. However, the ACA does not require families to purchase standalone dental coverage if they're buying a health plan that does not include pediatric dental coverage. And as we'll talk about a little bit later, the cost of standalone dental coverage is not typically considered in how a consumer's premium tax credit is calculated. So digging in a little bit deeper into Kansas, for this upcoming plan year, almost every county has at least one qualified health plan at each metal tier, bronze, silver, and gold, with pediatric dental coverage included. There are two exceptions, Johnson and Wyandotte counties, and this is primarily a result of the fact that a specific Blue Cross Blue Shield provider has decided to include pediatric dental in at least one of their products in all of the counties that they're offering in. Johnson and Wyandotte counties do not feature plans offered by that insurer. So again, the question is, if a family is looking to cover their kids on the marketplace, do they have to take up dental coverage? And again, the answer is if that coverage is offered through a standalone dental plan, and there's at least one of those plans on the marketplace, the QHPs are not obligated to offer pediatric dental coverage as part of their products, but they're certainly allowed to. And the law itself does not require families to purchase that coverage. So if you're asked, by a family who's purchasing a health plan for their kids, do I need to buy a dental plan to cover my children? The answer is, that you're not required to, but given, depending on the plan that they're selecting and whether or not it includes dental coverage, they may choose to. So comparing coverage options, looking at standalone dental plans versus QHPs that include pediatric dental, this is just kind of a side-by-side. So again, standalone dental plans in Kansas specifically are optional to purchase. There's no requirement, so you can check out of the marketplace with just a health plan. There is, of course, a separate premium because this is a separate policy itself. There will be a separate deductible and a separate out-of-pocket maximum that applies specifically to the standalone dental plan. So those two things are not integrated across the health and dental plan. Typically, there are adult dental coverage options available through standalone dental plan insurers for an additional cost. It's also worth noting that cost-sharing reductions, which are available to low-income families and individuals up to 250% of the federal poverty level, do not apply to standalone dental coverage. So those cost-sharing reduction plans that we often see on the health plan side would be non-existent on the coverage options that you would see when shopping for standalone dental plans on healthcare.gov. And there are a few consumer protections that do not actually apply to standalone dental coverage. On the health plan side, basically the contrast to what I just said with a few notable additions, one of which is that for the most part, health plans on the marketplace will have a unified deductible that applies to not only health benefits but also dental benefits, and this is certainly true in the Kansas marketplace from the plans that I've evaluated. So what that really means is it could be very expensive for some families to utilize their children's dental benefits if they have not met that medical deductible, and so they would be on the hook for the cost of any services that are to which that deductible applies. And we'll take a closer look at some of those plans a little bit later. So I'm going to pause there for a second and see if there are any clarifying questions before I move on to the digging in a little bit further to the factors that families would need to consider.
So yeah, if anybody has a question, I don't see any yet, but if you want to either raise your hand or type a question in, you're most welcome to. Oh, and I don't see any questions yet.
Great. That means I've not screwed this up so far.
So far.
So the first aspect of coverage that families will want to consider is how the plan is structured and what types of consumer assistance are available. And I touched on one of those points earlier. So when looking at the plans themselves, we will see that they do not always outline services and service categories in the same manner, which can be confusing if you're trying to do an apples-to-apples comparison. So it's important to know that that CHIP benchmark plan that I showed us earlier is the basis for what services have to be covered. So I would say that would be a good reference point if you're unable to dig up a detailed list on the plan documents that are available on healthcare.gov, especially on the health plan side. This can be the case where they don't provide a lot of detail, to reassure families that, yes, these are the services that will be covered, but they may be covered differently from plan to plan. Cost sharing, of course, how much the plan pays for specific services is also going to vary from plan to plan. And the deductibles themselves may apply differently from plan to plan. Kansas is not a marketplace that has any requirements for standardization of plan design, as we sometimes see at the state level. So it's really the plans the insurer's prerogative to determine how they want to structure these aspects of plans. And again, on the health plan side, that high medical deductible can be a barrier to accessing those pediatric dental services. With regard to out-of-pocket maximums, so this is basically a statutory requirement that says, once you have expended this much based on your income and based on the type of plan that you've selected, you will no longer be required to pay out-of-pocket for covered essential health benefit services. So, as I mentioned before, for standalone dental plans, there's actually a separate out-of-pocket maximum that applies, and that's in addition to the out-of-pocket maximum on the medical side. So someone purchasing a standalone dental plan and a health plan separately would have two out-of-pocket maximums that, theoretically would be added together to reach their potential maximum out-of-pocket obligation. So the standard for that, which is set at the federal level for standalone dental plans, is $350 for a single child or $700 for more than one child. If the dental benefits, conversely, are included in a qualified health plan, that medical out-of-pocket maximum that's set at that plan level would apply to all of those benefits, including pediatric dental. So this is just kind of an illustration of how that works. These are actually numbers from last year, but the concept itself is the same, which is that if you're looking at a health plan that includes pediatric dental here on the left, you've got one single out-of-pocket spending limit. Whereas on the right, if you're buying a health plan that doesn't include pediatric dental and selecting a standalone dental plan to fill that gap, you will have two out-of-pocket maximums, the total of which is $350 to $700 higher than the out-of-pocket maximum for the health plan alone. So this again would be something for families to consider, especially if they anticipate having different levels of need for health and dental services. Looking a little more closely at the premium tax credits, this is, of course, something that will have already been determined, but we do often hear questions from consumers about how the premium tax credit does or does not help them purchase dental coverage. So as we know, the ACA subsidizes the purchase of plans on the marketplace through premium tax credits for individuals and families earning up to 400% of the federal poverty level. Those tax credits are paid to the insurers, and in the case of dental coverage, is actually paid first to the health insurer, and any remaining tax credit then goes to the standalone dental plan. However, because of the way that the tax credit is calculated, being based on the cost of the second lowest cost silver plan in the marketplace, that calculation does not take into account the cost of standalone dental coverage if a family needs to purchase both a health and a dental plan in order to fill all 10 of those categories of essential health benefit services. So in other words, a family is really only getting a tax credit based on the cost of that health plan. There's not typically going to be anything left over to go towards the purchase of standalone dental plan unless they're buying a very, very inexpensive health plan, and that would probably have to be a bronze plan. So this is something that will be changing for the 2019 plan year if all proposed federal regulations are finalized and the Affordable Care Act remains in place. But for the time being, this is the state of how the premium tax credits apply to dental coverage, which is to say that they largely do not. Consumer protections, as I mentioned, some of the consumer protections do not actually apply to dental coverage when it's offered through a standalone dental plan. I think it's safe to say that especially in the Kansas marketplace, given the fairly limited offerings available, that most families will be making their decision based solely on financial factors. But it's worth noting that protections against denial for pre-existing conditions, guaranteed issue and renewal, and probably most importantly, the right to an external appeals process are not actually requirements of standalone dental plans. Network adequacy is also probably a factor to consider. most of the plans that are available on the marketplace will allow you to take a look at the provider directory, as far as I've seen from the documents available. And so consumers should have a sense for whether they have a dental provider that they would like to stick with, and whether that dental provider is on the network of the plan that they're considering purchasing, and B, whether and this can certainly be an issue in Kansas, whether there are dental providers near them that are actually in their network, because having to travel quite a distance to see the dentist can certainly be a barrier to accessing that care. There are, however, essential community provider requirements, and there are a number of different types of essential community providers that may be available. On the dental side, this would be most notably federally qualified health centers. So that would be potentially another avenue for families to seek care if there are not an abundance of providers in their network near them. So looking at some examples of plans that are available on the Kansas marketplace, starting with standalone dental. This is a fairly typical plan that you will find on the Kansas marketplace. This is a Best Life plan. There are two tiers of standalone dental plans on the marketplace, a low and a high. The low is sometimes referred to as silver. And so this is how the services are laid out specifically in the plan documents for this plan. So the out-of-pocket maximum for one child is $350, $700 for two or more children. This is going to be standard across all of these plans. There are some differences from in-network and out-of-network services. The annual deductible for this plan is $75 for in-network care and $100 per child for out-of-network care. The coverage for in-network basic and preventive diagnostic services, kind of what you could expect to get at any typical dental visit, are 100% covered as long as they're in-network. More advanced services are paid at 30% and 50% respectively, including those medically necessary orthodontic services. And this plan specifically lays out what that standard is for medical necessity when it comes to orthodontics. So they're saying that you would need diagnosis for a problem that requires repair of a disabling malocclusion or cleft palate, severe craniofacial defects, or injury impacting function of speech, swallowing, or chewing. So again, it's important to communicate, if a consumer is wondering if they're going to be able to buy a plan that will allow their child to get braces, the answer is maybe not, because there is a fairly strict medical necessity requirement that is placed on orthodontics. This is another example, and again, these services are laid out slightly differently. This plan breaks them down on a little more detailed basis and actually has a number of different tiers of cost sharing for the specific services and categories of services that they offer. The deductible here is $50 per child, but they're going, they've got a little more granular change from service to service in terms of how much the plan is willing to pay for, and of course that changes again from in-network and out-of-network services. So this is really just to kind of demonstrate that from plan to plan, the way that they describe their coverage is going to look a little bit differently. And here we have a qualified health plan. So Blue Cross Blue Shield Kansas Solutions Incorporated is this year the only qualified health plan in the entire marketplace that will feature pediatric dental coverage, at least according to the data and filings that I've seen. So they do have at least one plan at each of the metal tiers that includes pediatric dental coverage. But the way that they describe that coverage is quite a bit different than the standalone dental plans. So it's much less descriptive in terms of the specific services that are outlined. So again, I would refer you to that description of the CHIP benchmark, which outlines what services must be covered, because the plan documents that are available on the marketplace for these qualified health plans are not exactly specific. They simply say checkup, major dental, basic dental, and then they do have, again, a description of that medical necessity standard for orthodontic care. It's worth noting that the individual deductible here is $3,000. The individual out-of-pocket maximum is $6,850. So that individual deductible applies to everything except for that checkup. So in other words, if a family has not incurred $3,000 worth of medical services or on this plan, they'll be paying out of pocket for the bulk of these children's dental services until they meet that deductible. And so that's an important thing to consider in terms of being able to easily access and afford the dental services that are included in the plan. So a recap of these factors, what consumers really need to know. What are the offerings? How is dental coverage being made available to them, whether it's through a qualified health plan, a standalone dental plan, and of course for adults who are looking to purchase dental coverage for themselves, which standalone dental plans are incorporating or allowing them to purchase additional dental coverage for themselves. I should probably note that any dental coverage for an adult that will be offered as a product on the marketplace from the standalone dental insurers will look differently from the children's coverage. It will in fact have dollar limits on that coverage because there is no ACA requirement to eliminate annual and lifetime caps for things that are not essential health benefit services. And adult dental coverage, unfortunately, is not. It would simply be a supplemental to what they're purchasing for their children. How those dental benefits work and how the plans differ in terms of plan structure, cost sharing, and the applicability of deductibles. The financial impact of their choice of dental benefits in terms of total out-of-pocket obligations, whether or not cost-sharing reductions are available to them, and whether or not the dental option that they're choosing allows the application of those cost-sharing reductions. The difference, of course, in premiums, and the applicability of premium tax credits. Of course, how their medical and dental needs could guide their choices. So as I mentioned before, if a family is anticipating having relatively low medical needs throughout the year, and yet they are looking at purchasing a qualified health plan that includes pediatric dental, which applies that, let's say, a $3,000 deductible to those dental services, they may want to reconsider because they may not actually get to a point where they're able to really utilize those dental benefits in the way that they're outlined in that plan. Consumer protections may be a factor, but as I said, I think the financial factors here are going to drive the bulk of consumer decision-making, given the relative lack of diversity of plans in the Kansas marketplace currently. And again, what providers are available to them, what providers are near them that are in the network of the plan they're looking at. So I believe that covers the presentation itself. I am happy to go back and clarify any points that I have made so far, but I believe we have left quite a bit of time for questions, answers, and discussion. So with that, I think we will open it up and see if anyone either needs me to repeat something, better explain something, or discuss something that I have not mentioned yet.
Thanks, Colin. We do have one question that is kind of a clarification. Hold on one second. Paige Ashley asked a question about preventive services and deductibles, so I'm going to unmute Paige so you can ask that question. Paige, you should be able to talk.
Oh, hi. I just wanted to make sure that preventive services like cleanings and things like that are not included in that deductible amount. And I know you had said about children, but then I also have the question about adults. Is that the same thing? Anything that's preventive cleanings, things like that, you do not need to pay the deductible?
So no, that's a great question. That is not actually necessarily the case, and that's going to depend primarily on the plan. So as you'll see here, the plan that I pulled up, they do not have that deductible applying to these basics and preventive services like exams, cleanings, x-rays, etc. But the law itself does not include in the list of no-cost preventive services what we traditionally consider preventive dental services. So let me go back to that slide if I can find it. These are really the only dental or oral health related preventive services that must be covered at no cost, meaning no deductible would apply to them. Otherwise, the preventive services would really, and whether or not they would be the deductible would apply to them would be the prerogative of the plan themselves and how they've chosen to design that benefit. So as you can see here on this Renaissance Dental plan, they are either applying a deductible to some of these services, or well, in this case, they're applying the deductible across all these services, and imposing some cost sharing on many of these services that would otherwise be considered preventive. So that's an important distinction, which is to say that what we traditionally call preventive services when looking at a dental plan are not necessarily preventive services for the purposes of the Affordable Care Act's requirements. Does that make sense?
Yeah, I kind of thought that a cleaning would be considered a preventive service.
Yeah, unfortunately, it is not required to be so for the purposes of exempting it from cost sharing and deductibles. And the other aspect of your question for adults, of course, is the same, which is that many plans will structure themselves such that those preventive services are no cost, but there is no requirement to do so. And there are even fewer requirements for how dental coverage must be structured on the adult side because it's not part of the essential health benefits. So it's really kind of viewed as just an add-on, so to speak.
Thank you.
You're welcome.
Colin, I don't see any other questions right now, but I kind of wonder, just a question out to the audience, if you've had questions or concerns or areas of confusion that have popped up as you've talked to families that are looking at purchasing coverage so far, either this year or in previous years, that we could maybe try to clarify here.
Yeah, I'm always curious to hear from consumer assistance personnel themselves what types of things they're hearing on the ground from consumers.
So again, to answer, all you need to do is either just raise your hand or type something in the question box. And
I will also say, if there are questions that occur to you after this webinar, my email address and phone number are listed on this final slide. So don't hesitate to reach out to me, and I will do my best to answer your questions. Excuse me. And I believe, Tanya, that you will have this webinar archived, and then we'll also be making available kind of a brief document that runs through some of these most important questions.
yes, we will. We will have on the Oral Health Kansas website, we will be able to post an archive of the webinar, and Colin is working on finalizing kind of a frequently asked questions document that will, like, as he said, cover many of these aspects. If there are specific things that occurred to any of you that you think might be helpful to address there, we'll certainly willing to make sure we put those in there.
Yep.
Basically, want to make sure that the pediatric dental benefit, as you've learned today, is a little different than the other qualified health or essential health benefits. So it's important to make sure that everybody's prepared when you're talking to families. So I don't see any other questions, Colin. Which means maybe I think you've done a great job of answering everybody's questions and helping us navigate this, pardon the pun, navigate this kind of interesting subject.
Well, I certainly hope so.
I wonder, just as oh wait, I do see one question. Hold on. Got a comment, maybe more than anything, from Karen Mays, saying, thank you, this is what I thought about these plans. You've given me more confidence to advise on the things that I thought I knew. So, Colin, that's nice job.
Great. I'm happy to reinforce existing knowledge.
Great. Well, I don't see anything else. So I think we'll just leave it there, and we will, as we said, post the archive of the webinar on the website, and we'll have an FAQ out just very shortly. We wanted to let this get through the webinar and see if there's any other questions that bubble up, and then we'll finalize that and get it out in the next few days.
Sure.
So thanks again, Colin, for taking the time for preparing this, especially a specialized webinar, so we understand exactly what the options are in Kansas. We really appreciate this, and I like the way Karen put this, that we appreciate you giving navigators and consumer advocates the confidence to advise families. So thank you, and thanks to everybody for participating in the webinar today, and be in touch with us if you have any questions. Thanks.